Hi, I'm Deekshita,
And I'm Shaina.
and this year we decided to focus on gynecologic cancer awareness. And the three cancers we tried to focus on this year is ovarian cancer, cervical cancer, and uterine cancer.
Just as a side note, please consult your doctor and go according to what they say. Each and every patient is different, and therefore they may have different symptoms, treatments, etc.
First of all, what is cancer? Cancer is a disease where abnormal cells divide uncontrollably and destroy body tissue. Cancer can also spread throughout the rest of your body if it is not detected early. The first cancer we decided to focus on was ovarian cancer. And ovarian cancer is a group of cells that start to divide uncontrollably in the ovaries and or related areas of the fallopian tubes and the peritoneum. Some signs and symptoms are vaginal bleeding, pain or pressure in the pelvic area, abdominal or back pain, bloating, urgent need to urinate, and frequent constipation. How ovarian cancer is diagnosed by paying attention to the warning signs and any abnormal changes to your body. And if there are some, ask your doctor about these types of diagnostic tests, which is rectovaginal pelvic exam, transvaginal ultrasound, and CA125 blood tests. Some treatment options is surgery, which is to remove the cancerous tissue during the operation, and chemotherapy, which is using medicines in pill forms, which is then directly given to your veins to kill or shrink the cancer. Some risk factors are middle-aged or older people, family history with ovarian cancer, genetic mutation called BRCA1 and BRCA2, have had breast, uterine, or colon cancer, and also having endometriosis, which is basically tissue from the lining of the uterus grows someplace else in the body. To prevent ovarian cancer is there's not a known way to prevent ovarian cancer, but things like using birth control for 5 years or more, breastfeeding, tubal ligation is effective for women who have BRCA1 and BRCA2 mutations, and having both ovaries and fallopian tubes removed. However, all of these prevention methods aren't recommended for everyone, so I would check with your doctor on the suitable prevention method for you, especially if you have the genetic mutation or have had family history of ovarian cancer. Some data and statistics is that ovarian cancer is the second most gynecologic cancer in the United States, and the American Cancer Society estimates in 2021 about 21,410 women will receive a new diagnosis of ovarian cancer in the US, and about 13,770 women will die from ovarian cancer in this year.
Next, we're going to look at cervical cancer. Cervical cancer is when abnormal cells in the cervix grow out of control and divide uncontrollably. What are the signs and symptoms? Some symptoms may include pelvic pain or pressure, abnormal or heavy menstruation, fatigue, nausea, or weight loss, and at an advanced stage, there may be abnormal bleeding or discharge from the vagina. Cervical cancer may not have any signs or symptoms as well, so regular medical checkup is the best way to diagnose cervical cancer. How is cervical cancer diagnosed? A Pap test can help find unusual cells in the cervix. Biopsy is used to further examine the cells, and then CT scans, PET scans, and MRIs are used to gather information on what stage the cancer is on. What are some treatment options? So standard treatments to remove the tumor may include surgery, chemotherapy, immunotherapy, and radiation therapy. The goal is to remove the cancerous tumor before it spreads, and each treatment may have different side effects on the patients. What are some risk factors? HIV, which can eventually turn into AIDS, giving birth to 3 or more children, the use of birth control for a long time, as well as smoking. How do you prevent cervical cancer? Taking the HIV vaccine when your doctor recommends it, quit smoking, as well as regular checkups. Let's look at some data and statistics. So cervical cancer was the leading cause of death in women, but the numbers have decreased due to an increased number of screening. In 2018, 8 out of 100,000 women were reported to have cervical cancer. 1 out of 4 deaths in the US is because of cancer. Lastly, we're going to look at uterine cancer. Uterine cancer is when abnormal cells in the uterine start to grow and divide uncontrollably. What are the signs and symptoms? Unusual vaginal bleeding or discharge, and that's usually in between periods or after menopause, more frequent and the urgent need to urinate, constipation, as well as pain or pressure in the pelvic region. How is uterine cancer diagnosed? You need to rely mostly on the signs and symptoms, and if you have these symptoms, then the doctor will perform an endometrial biopsy or transvaginal ultrasounds.
Some treatment options for uterine cancer is surgery, which is to remove cancer tissue, radiation, which is to kill the cancer by using high energy rays, and chemotherapy, which is basically using medicines to kill or shrink the cancer. Some risk factors are people who are 50 years or older, having obesity, having family history of uterine cancer, trouble getting pregnant, taking estrogen without progesterone, and even those who are not at a high risk can still develop uterine cancer as well. How do you prevent uterine cancer is complete prevention is not possible, but you can lower the risks by eating healthy, being physically active, taking progesterone if you are taking estrogen, and doing regular screening. Some data and statistics are that the American Cancer Society estimates for uterine cancer in 2021, about 66,570 new cases will be diagnosed, and approximately 12,940 women will also die from cancers of the uterine body in 2021.
These are the resources we used to research the information on the slideshow. Thank you so much for watching. As always, awareness is the key to prevention, and we hope you took something new from this video. Go ahead and follow us on Instagram at cancer_awareness_HOSA. Thank you.
Thank you.